Hello, and welcome to the May video for Critical Care Medicine. I'm John Sevransky. I'm the editor-in-chief of the journal, and I have the tremendous privilege of having two senior editors of the journal, David Maslove and John Marshall, and we are going to be talking about some of the background behind the article Development of a Core Critical Care Data Dictionary with Common Data Elements to Characterize Critical Illness and Injuries Using a Modified Delphi Method. That was written by David Murphy and colleagues and will appear in the May issue of Critical Care Medicine. So, David, as a big data scientist, among other things that you're good at, can you tell me why it's important that you define common data elements when you're looking at large amounts of data?
Yeah, it's a great question. And as with all things data and data science, the answer today is probably different than it would have been a year ago or even 6 months ago. And it's probably not an answer that will age well in the coming months and years as well. But traditionally, data science models that we use in machine learning models are extremely good at handling numbers and complex mathematics, but not as good at handling concepts and meaning. And that may be changing with some of the new artificial intelligence models that are being perfected. But for the time being, you sort of need a group of people to agree on what something is and what the important things are, and then how to define it and how to find it in your own medical record. And the main rationale to do that is so that the computer can collect it and compute with it and know that it's got the right variable. And this even applies to things that might seem really simplistic, like heart rate. On the surface, it's a vital sign that we use every day. Everyone tends to sort of know what that means, but if you're a computer and you're faced with a huge trove of data from an EMR, you need to know if we're talking about the heart rate derived from the pulse oximeter, or is it the heart rate that's derived from the EKG tracing? Is it the maximum heart rate over a period of time? Is it the minimum heart rate over a period of time? And so on and so forth. And so by identifying those elements and giving them a precise definition, teams that use that data dictionary can then make linkages to their own data warehouse.
Thank you. And you've highlighted, I guess, one difference in that the authors used a Delphi method, which involves agreement. And I wonder if you could contrast the human factor versus the machine learning factor that one might use to come up with a common dictionary.
Yeah, I think it is an excellent question that returns to that sort of concept of meaning and whether the computer so traditionally could do a frequency count or sort of decide how often a concept appears in a certain data set or how often a concept appears in the literature or in certain analyses. But as we've seen from all kinds of examples, just in the lay literature and the media, counting the frequency with which something occurs doesn't necessarily mean that it's important or mean that we truly understand what it's conveying. And so for the time being, and I would sort of put that in quotes because AI models may be getting better at this, but for the time being, it takes some human expertise to sort of determine what is important. And the other thing that's really unique about a Delphi process is that you get agreement amongst a wide range of participants and stakeholders. And that's something that is probably harder to achieve computationally.
Thank you. So, John, you've been involved both with national trials and international trials for a few years now, and this effort is, while it does involve people nationally and internationally, I wonder whether you could talk about why it's so important for an international group to use the same data elements and the same data dictionary.
Sure. Well, I think, I mean, to start off, anytime one conducts a clinical trial, one's collecting data, and it becomes important that the data that I am collecting are the same as the data that you're collecting. And that's why we have case report forms, and that's why we have protocols, so that at the end of the day, you know that what you've described is going to be similar to what I've described, and therefore we can pool those data and draw conclusions from it. It becomes even more complex when you're doing it across trials within a country, and orders of magnitude more complex when you're doing it across countries and potentially across trials. But as we move to an era where collaboration amongst trials and asking questions at large scale is increasingly recognized as critical to being able to draw reliable conclusions, it's important that we have the consensus on what the information is, and some commonality about how it's collected. For example, things as simple as how is the date recorded? How's the date recorded? Is it month first? Is it day first? Or is it year first? That varies from one place to another. How is the day defined? When does your data start? Is it at midnight? Is it 7 o'clock? Is it at noon? Is it shift change? All of those things ultimately can introduce bias into a study, because if you're systematically collecting it differently in one jurisdiction from another one, then the date may actually be starting 10 hours later, in which case the outcomes that you're seeing may have been impacted that way. And I think the other thing is that just the pragmatic issue of how to actually pool data across trials if you can't come up with a common language that allows the trials to say, yes, this is a sodium level, and all sodium levels are recorded this way, and therefore we can average the sodium levels across the different sites. When do you measure it? How often? How do you deal with the fact that if you measure a variable more times, you're more likely to get extreme values if you're taking the extreme values? So there's a lot of areas where there's consensus needed if one's going to be able to draw reliable conclusions. And frankly, we don't have a good handle on how what the impact on the reliability of the conclusions would be, as these things are not standardized.
Well, thank you, John and David, for helping us to better understand the importance of having a common data dictionary. Um, the index article, Development of a Core Critical Care Data Dictionary with Common Data Elements to Characterize Critical Illness and Injuries Using a Modified Delphi Method by Murphy and colleagues, can be found in the May issue of Critical Care Medicine. Thank you all, and have a good day.
Thank you.